by yeast and also afflicted by it. Okay? When we look at yeast, there is a researcher named Pavel Knieval, N-V-A-L-D-T. Pavel Knieval was an orthopedic surgeon from the Ukraine. He came to the United States after he had worked with the Ukrainian army and couldn't practice here in the States, so he actually began studying other things and got a degree in naturopathy and homeopathy and practiced in Portland, Oregon for a while. The guy is fascinating. The only reason I bring up his name is he wasn't understood when he was in the States, and so he actually went back to his home country. But this guy was brilliant. He had a theory that all infections are basically progressions of another infection. Or in other words, when we look at a true yeast infection, in essence, let's look at a yeast as a concept of a mushroom. Okay? Underneath the ground are these little running roots, and some people are familiar with these because, like a running root, in their spine there are also running nerves, and they've had nerves that are cut. Are you familiar with that? What is it called? Rhizomes or rhizotomies. Remember that? So the rhizomes are these running roots that run under the ground. Okay? They'll actually have stalks that will come up, and then you actually have the mushroom itself, so you can see or visualize the stalk itself. And then from that, welcome, save you a seat. From that stalk will actually come out then little spores. And these little spores then, Dr. Knieval described an infection, an active infection, similarly in our bodies. In essence, he said that the spores represent viruses. His theory was that the active infection that you can see is most commonly a bacterium. And underneath that, under the ground or in the body itself, is this underlying yeast. And I just wanted to present this theory because there's some other infectious disease specialists that are starting to view disease more as a continuum. So rather than just saying, oh, I had this virus, I was coughing, I had these symptoms, they're starting to see the virus more as a spore or a seed that's transferred, and then once it lands in a proper and healthy environment, it uses our body's DNA to actually grow and reproduce. And so we see this bacterial phase that is using cell genealogy. Welcome. Cell DNA to actually create then an active infection. And underneath this subclinical infection that just hangs out underneath the surface, this rhizome or this yeast is what he sees. And so, kind of a fascinating theory. And I just wanted to share that with you tonight as we kind of look at the different layers of infection. And tonight we're going to talk about this blanket or this mesh or this infection that oftentimes will afflict different connective tissues and membranes in an effort to sometimes create a membrane. Okay? So last week when we ended, we had talked about our bodies have 4 separate barrier systems. Remember those 4 barrier systems, those of you who are here? What are our barriers, our body barriers? Do you remember? Skin. Good. What's another barrier that we have? So skin is one, so it protects us from the outside and also keeps us in. Okay?
Your white cells.
So our white cells are actually not a barrier system. Okay, that's our immune system. So we're talking about specifically 4 barriers. So skin is a barrier. Okay? And actually our GI system, the gut, is a barrier. Okay? Another barrier is our lung barrier. The lungs are a barrier to the air, the outside as well, on the inside. Okay? And the final is what we call a blood-brain barrier. So these 4 barriers create for us a sure wall or a protection not only from the outside but also from the inside out. Okay? And when any one of these barriers becomes fragile or broken, often we'll find a connective tissue or an underlying mesh can be formed to either strengthen or create potentially a weakness in that barrier system. For example, what is in our GI system at the mouth, what is it on our teeth, Barb, that we call this meshing barrier system on our teeth? Familiar with that? What do we call it though? The living form is called a
biofilm is what I want to say.
Yep. The biofilm is on the teeth, and we actually have living biofilms on our teeth that can either be healthy and healing or actually creating caries and decay. Okay? So our bodies are consistently allowing symbiotic relationships to either benefit or destroy. When we've been exposed to or have a breakdown further down in this GI system and we've been exposed to heavy metals, our body allows this meshing integration to occur by creating or allowing yeast to actually build a barrier and create a secondary membrane that prevents heavy metals like mercury or cadmium, lead, or any of those other types of heavy metals from entering the system. Isn't that fascinating? I think it's fascinating that the body can actually do that. And sometimes yeast infections in the GI system can become then this secondary barrier as a protection against heavy metals. Okay? I saw a fellow that came to us from Idaho who had difficulty breathing, and he had a compromised airway barrier. And oftentimes what I've seen, especially in children, the children that have chronic coughs, so this seasonal chronic cough, I get it my little kid starts to cough in the spring, and then when summer comes, it goes away, and then as soon as the cool air comes in the fall, they start this cough again. I've seen several young children now and adults that are exposed to different barrier busters, if you will, allergies sometimes fumes, sometimes smoke, and they'll start to attempt to allow yeast again, even in the lungs, to create a barrier or enhance the barrier system. So they'll end up with this chronic cough. And oftentimes when we check that, it's seen as an elevation in white blood cells and may also be indicated on labs with elevated fibrinogen. Okay? So I just wanted to show sometimes those are actually attempts to protect or strengthen the barrier system, right? What happens when we actually start to see the breakdown of the system? Okay? Oftentimes skin yeast, we've talked about skin yeast infections a couple of times, but most common skin yeast infections we see as diaper rash, right? Baby has diaper rash. We see that in our infants. We also will see, though, a concomitant infection, or the source of that yeast infection is usually coming from where? Mom. Okay? So what we look for in mom will be cracked and bleeding nipples during their nursing, which they hate. I hate nursing. It's so painful. But that's usually because the cracking and bleeding isn't because of baby saliva, right? God didn't make this perfect feeding system to be broken down every time. There's actually a yeast in mom, and that yeast then is being carried over. Did you want to raise your hand on that?
Oh,
okay.
Sorry.
How about you?
No.
Okay. So diaper rash, and in the mouth then, for baby, is called thrush. Okay?
That's what I was going to ask.
Correct. It's thrush. Okay? Now thrush does not only occur in infants. Have you ever seen adults with a white thrush or leukoplakia or something like that? Much more serious oftentimes in adults as far as getting rid of the infection, and can often lead to or be an indicator of much more serious infections, right? When we start to see the leukoplakia in adults, oftentimes what we're seeing is a breakdown or complete breakdown of immune and body system due to a very specific virus in this condition. Okay, so that's much more serious when we see that in an adult, because it means their system is really broken down. All right, for baby, oftentimes it's just there because it's being passed directly from mom, and I don't have an immune system yet, so I'm dependent on mom to give me an immunity, but I'm getting an infection delivered. Okay, so oftentimes when you'll see the diaper rash and mom says I'm cracked and bleeding, you'll see also baby will have this projectile vomiting that smells very much like yeast. Or you'll see them spitting up on the shoulder pads or on the burp cloths, and when you smell it, it smells like yeast. Have you ever smelled that? Anybody had a baby where you've been burping the baby? It's like, wow, that smells just like rising bread dough, right? I didn't give baby bread. It's too young to even have teeth. So when we look at those types of infections, then yeast is a very common first infection for baby that may be compromising their system. That the first person that we should actually treat is not baby, but mom. Okay? So that's the real key on the take-home tonight. We've had lots of children that have been brought to us where they've had this thrush presentation, they've had this vomiting of yeast, they've been on, as an infant, under 3 months old, nystatin. Very strong drug for eliminating yeast in the GI system. And once they get done with it, they're put back on it, and put back on it, and put back on it. And then they finally come to us and we say, well, have you been treated, Mom? Do you have yeast infections? Oh, all the time. I've had them for years. I've got one right now, right? It's terrible. So we have to clean up Mom to clean up baby, okay? So let's move forward then from that and look at, along with yeast come molds and fungi, okay? Many of us are familiar with the molds that are called and fungi, and we'll actually, a lot of people are familiar with the classification of Tinea, okay? Have you ever heard of Tinea? It's a family of fungi, and what we're looking for in this case is Tinea. Tinea refers to the family, and then this is the region of the body that would afflict. Okay, Tinea pedis, crus, and capitis. Are any of those familiar phrases to you?
Pedis.
What is ped? What is pedagogy? Or a pediatric, or not pediatrician, but a podiatrist. Thank you. Okay, so this is the feet. Tinea pedis. So on the feet, and what would that be called? Athlete's foot. Exactly. Okay. Crus refers to the growing area. So that would be jock itch. Exactly. And then caput, or caput, is the head, right? So capitis, and this often Tinea capitis is often dandruff. Alright? But we're familiar with these names, more familiar with those names than these names. Okay? Another very common summer tinea is a Tinea Versicolor. Okay? Have you ever seen Tinea Versicolor? You usually don't see it on people who are really fair, except in the summer when they tan. Because Tinea Versicolor is a fungus that will actually affect the melanocytes, and it will make a blotchy appearance on the skin. Okay? It's usually on the torso, and it's very, very easily transmitted just by going to the swimming pool, picking up a towel that's been on the ground, and then drying yourself off, and then drying off another kid, and the next kid, and the next kid, and all of a sudden you'll notice that there's this blotchy appearance on the torso. So what you'll see will just be these little, and think of the negative, if you will, okay, the photo negative of this, because I can't really color it in unless we did this. Basically, on the skin, what you'll see will be these little blotched out lesions that look like this, okay, in the tan. And the child will often say it's a mild itch. When they sweat, the more they sweat, they'll experience more of this mild itch. Okay? How do you treat it? Topically, we just use a dandruff shampoo. So you can use any of the blues, okay? And you just apply it topically. But you'll see this, and most of the time we don't realize what it is because our kids aren't, that's so painful. But when they sweat or after they've gotten out of the pool or out of the chlorine, you'll see this mottled, blotchy appearance that does not go away as they tan. It actually will get worse as the summer progresses, and it will continue to infect or afflict large areas and patches of skin. The problem with it is it's very contagious as well. So the child will use the towel, hang it back on the drying rack, and the next child comes in, uses the same bathroom, and then ends up drying off, and now they'll end up passing this back and forth. Okay? So just a good one to be aware of.
Is that different than